I live in Venice, Florida, which is around Sarasota.
Okay, guys.
Oh,
Okay. Hi, guys. It's Dr. Sandy. Happy Nurses Week. I have the lovely Christy Hemingway and I have Mary Taylor with us today. And we have a great show tonight. I'm very excited about it. It is also our last one in Orlando. So I'm super excited to go back where everything started. So before we get started, I would like to, I think we wanted to kind of do something today. So we're excited because today is Flo's birthday. This is her 200th birthday and the history of what she has brought to us. And I'm sure Christy and Mary are going to chime in about, hand washing and how important it is for infection control. And look at what we have going on right now. We have, a lot of things happening with infection control and how important it is for us to remember to wash our hands and cough in our arm and to recognize and to our healthcare workers as well as those that help us with our jobs. It is extremely important because right now we're at that point where we can't give people hugs or really high fives really that much right now. We can't support each other the way that we used to. So we're trying to have to adapt. And what a great topic for, thanks to Flo, which yay, Flo, happy birthday. So we are we are going to talk about some pretty important things and to be on her birthday, as well as also being Mental Health Awareness Month. This is a special time to be able to talk about some pretty important topics, things that are happening in nursing and in healthcare, and even to the people all across the nation and the world. Everybody's going through a lot of trauma and I'm trying to adapt to this new way of life. And it's hard for everybody, including nurses, being apart from their family members. And just, I want to mention, there is a young lady that was brought to my attention that she was in New York City, and I'm going to be touching base with her shortly. And she was staying at a hotel, and the hotel found out she had tested positive for COVID and was taking care of patients in New York City. And they had her pick up her stuff after she was 6 days into it and move her things to another hotel that would accept her and she had to search for one, and she was COVID positive. So shame on that the hotel, and shame on anybody that ostracizes somebody that is suffering from COVID, because let me tell you something, it isn't affecting everybody the same way. And there have been young people, and now it's affecting children in a totally different way as well. And besides the physical illness that's coming from this, well, how about the other things that are happening, the things that we don't see? So I'm gonna chime in with Christy, and you guys can Mary's gonna give us some extra topics too. What I found for myself, I also posted some stuff into the group tonight before we started about burnout and also PTSD. I would like you to look at those articles, and you can also find some recent stuff, but for hard facts and statistics, these are the only things that I could find. This one article from the NIH was posted in 2009. So, and we're going to talk to Christy right now, and then we're going to chime in with some statistics and to really get to the bottom and open this wide up, because we need to understand that it is okay the way that you're feeling. It is okay. Okay. I know that was 2 okays, but it's not. You're entitled to feel the way that you feel. It's a very stressful time. We are human. We are not machines. And if you're going through a tough time, please reach out to the Suicide Hotline. We will have that number for you as well through the show. But I want to welcome Christy. You can unmute yourself. And Christy is very special to me, and her and her husband Brian, and I've known them a couple years now, right?
Yeah, working on a couple years.
She's one of our admins on our page and in our group where, Nurses Against Violence Unite. We have the group that is like a support group for other, people to come forward to talk about the things that they're going through, to not be met with criticism or nasty comments. to be more healing and more like, caring. And I want to thank everybody that's in our group that does participate and helps to bring these people to, like, I've been in your position. I understand. Well, and then they start talking offline. We've had people that have met at at Starbucks, right? Not as a couple, but like to talk about the things that they're going through. This means the world to me. This is why we have Nurses Against Violence, because we are a family. And I love, so if you have any of these stories, please bring them forward, because I just love these stories that are coming up with our group. So I'm sorry, Christy. So, but I get so excited. So I want to welcome you. You wanted to talk about something very special to you. And I'm going to turn the mic over to you and let you discuss about all the things that are happening. And so, feel free to talk it up.
All right. So my name is Christy Hemingway, and I am an RN. I am currently in school getting my doctorate. I have one and my nurse practitioner. So I was working for about 10 years for a very large hospice. It had about 1,000 to 1,100 patients. I was the director of one of our home teams. We had 150 patients on any given day that I was responsible for, in addition to like 22 staff members. So it was a really big team. It was a really busy team. And these people are going into people's homes, meeting them at one of the most vulnerable times in their lives. And then the rest of my background is emergency room nursing. So I have, I like the stress for some reason. What we had in 2013, when I was the director of the home team, we had one of our educators come in and gave us a CEU opportunity about compassion fatigue and burnout. And this was the first I had heard about it. And I'm like, man, there's so much of what she's saying that I relate to. My husband also worked for the same organization. He's a nurse also. And he heard it. He's like, man, there's things that I relate to. And we were talking about it at home and whatever. And it's only been since then that we have realized that compassion fatigue is just like a dressed up term for PTSD, because that's really what it is. You think about it, you're going into these patients' homes or seeing patients in the hospital, wherever, and you're going through this day in and day out, getting people that are sometimes really rude to you. Sometimes they're really awesome. Not every patient's rude, of course, as we all know, but sometimes you get those really hurtful and hateful patients, and it just kind of wears on you. And some days are better than other days. And some days you come home and you cry and you say, why did I even get into this profession? Am I even helping anyone? And then when patients die and you've done so much for them and they die and there was just really nothing else that you could have done, but yet you feel guilty. And all of that builds. And especially right now, I know my last day working in the emergency room, I was working in the quarantine unit at the hospital, and where we were taking all of our COVID patients, but possible COVID patients. And so I had my capper on, I had my gown on and everything. And it was really stressful. And I was changing before I left the hospital to come home. And then immediately going and jumping in the shower and everything. But I was still worried that I was going to bring that home to my family, to my daughter and my husband and everything. And so there's that added stress as well. So I think that we really are going to have a lot of situations. We are having a lot of situations and are going to have worse situations of PTSD as a result. And one thing that I have found that has really helped myself as well as my husband is having somebody to talk to, going and getting therapy, going to a psychiatrist, a psychologist, getting that extra therapy, CBT therapy, EDMR, whatever it is that they think would be the best treatment plan, sometimes medications, and that's okay. There's nothing wrong with getting help. And I think that that's really important for people to realize that it's okay to ask for help. You have anything you want to chime in on?
Yeah, so I have some things personally. Let me, before I get started, I want to give everybody the suicide hotline. Also, if you're having some serious stress in your life, there's a couple different things that we do as nurses, and it's a great practice. It doesn't help all the time, but if you should feel like you need some severe, some serious help, there's the National Suicide Prevention Lifeline, and it's 1-800-273-8255. Again, 1-800-273-8255. It's very important that you please make sure that you call that or go to the nearest emergency room if you're feeling any kind of excess trauma. I know that there's a lot of things that are going on right now. Don't be afraid to reach out because of it, because if you are having injury up here, it's going to affect everything else in your life. So I could chime in on some things and why I became a nurse. Some of you guys know a little bit about my background, and I grew up, my mom was very unstable, and she was Munchausen, big time Munchausen by proxy. My chart was probably about this big. And I don't think I was really physically injured, but she rushed me to the doctor every 5 minutes. I go through a lot, I have some PTSD, from that, because of the fact that trying to be my mother's mother with her crying in the corner, and, her telling me at 10 years old that she, didn't know how to be a mom. On top of that, I moved probably 30 times in my childhood, and, my kid friends, I'm just getting reconnected with on Facebook, over the past few years. But I never really had any stability. And when I was 16 years old, I worked 3 jobs because my mom took off, and she was highly unstable, and she did the best that she could. She didn't know she couldn't. She thought it was a bad thing to reach out. Well, with the mental health stigma that we have in healthcare, it's pretty thick. We want to be the hero, but yet we're not ready to be the hero, for ourselves. And this is extremely important because as we're reaching into a new era of nursing, we need to take care of ourselves so we can be okay. And I feel very strongly if these signs and symptoms were recognized, and it wasn't just the Munchausen by proxy. My mom was a special character. She went to the ER where I worked, complaining of chest pain. When they admitted to her, she got up and she was miraculously cured and was walking down the street. She went AMA. Now, this is a lot of the patients that we work with every day. Yeah. So we need to understand that, what they're going through is what's happening in their own head. My mom felt comfortable by talking to a nurse that was so busy doing their transactional, like getting meds, doing their assessments, doing all of that stuff. I know I did it out of order. Sorry, guys. But if she felt comfortable by talking to somebody, if somebody was there readily available for her to talk to them, would I be here talking to you today? Probably not. But here I am, and so we're going to try to help save another little girl from having to go through any of this by helping her parents, right? Hopefully. So it's taken a lot out of me to say this, but we can change. We can change. We are human, but we can change. It all starts with us. If our minds change, if we can make and condition our mind to think that it's okay, right, to just come out and talk to people and say, you know what, I'm going through a hard time. Can somebody talk to me? This is why we're here with Nurses Against Violence. We are not licensed therapists, but we are friends. And what we do as nurses is we get each other and we grab a hold of each other and we love on each other. Sometimes you might think differently. That's when all that other fun stuff comes in with what nurses do with, back and forth bickering. But the best part about nursing and what I love about what we do is that we have the biggest heart. We love our people. We love everybody. And being a global international organization that we are, we're able to touch and affect so many people in the process. But we need to remember what's important, and that is for us to be okay. If we are not okay, our patients aren't going to be okay.
Exactly.
We are the role model of our patients. We are the role model for our family. These nurses that are going out there and risking their lives with all of the things that are happening, with no adequate equipment to go and fight a war. I'm getting chills, guys. Like, I just can't. They are heroes. I don't care what anyone says. Yes, it's a part of the job. But you know what? A part of the job is having the right equipment. Yes, I know I'm constantly talking about that, but you can't tell a fireman to go into a fire without a hose or a breathing mask. You can't. Right? So we need to lift them up too. We need to reach out to them and give them a virtual hug. And we need to say, hey, I understand people are asking you how you're doing, but really, how are you doing? Talk about, like, we have our wingman, right? Like, Christy, you're kind of like my wingman, and vice versa. Mary, you haven't got that far yet, but we're getting there.
Getting there.
Getting there. Mary is very new to our group. She's venturing off into our Together Wellness, which is going to take Nurses Against Violence Unite. We are going to change the face of healthcare by doing exactly what I'm saying, reaching out and hugging people. And we're looking into, down the line, becoming an third-party insurance carrier, so people can have their insurance through us instead of having it through their employer, so they can keep their mental health care private. That's important, right?
But it shouldn't discourage anyone from getting the mental health assistance that they need as well.
Absolutely. And by all means, if you're feeling like you want to, hurt yourself or somebody else, please reach out to going to the emergency room. These are just plans down the road. This is nothing right now. This is not happening right now. But if you have somebody that you can talk to, please reach out to them, and you're more than willing. We are here for you in the group. Just look at the admins and mods, each one of us, besides Ash Rizaldi, that's my daughter. She'll let me know if you need to talk about something, but we are a team, every single one of us on this webinar, as well as in the group. So we have so you were looking at something, Mary, right? You wanted to discuss the article that you were looking at?
Yes, I was looking at an article from the Nursing Times, and it features Annette Kennedy, and she's talking about the current situation with all healthcare workers and the stress. We already know that nursing as a job is stressful to start with, and now this is just magnified, compounded by inadequate equipment, compounded by the public's opinion of the healthcare system. Many think it's a hoax. Many think the numbers are skewed. I see day after day on our local chat column, many people referring to articles, oh, the numbers aren't right. If it's so bad in the healthcare system, why wouldn't the nurses be dropping like flies? That doesn't help. That doesn't help. And they don't understand. They are not privy to the information or the activities within a hospital. It's strictly forbidden. It's posted all around the local hospital here. No cameras, no press, down to the fact, and this makes things worse for the staff, they aren't allowed to talk to anybody. Mm-hmm. They aren't even supposed to talk amongst one department to another. My husband works there, and he says, they're told in meetings, do not be discussing this in the hallway. So that just kind of compounds, who do you talk to?
Mm-hmm.
I don't know if they have any psychologists rounding through the hospital. I don't know about that. But if it isn't, it should be. And that's something that Annette touches on in her article, a cry for healthcare workers to be treated on spot. I know a place I used to work at years ago had previously been a Catholic hospital. And at any given time of the day, 24 hours a day, 365 days a year, there was clergy there at all times if you needed it. And they would always come and ask, do you need something? I can get somebody to help you. It's been a long time since I've seen anything like that, but it definitely needs to be going on. For people to reach out to anybody and talk, especially your teammates, because like we all know, we get each other. So it's a scary situation that we're in right now.
Yeah, I agree. It really truly is. Again, I'm going to let you guys know the 800 number for the National Suicide Prevention Lifeline. It's 800-273-8255. I was, so my doctoral project was on preventing patient on nurse violence through education, because there's literally no education out there in reference to like statistics. There's really not a lot of recent statistics. What I found for 2009, and I posted something in the group as well for Burnout, but this article for the NIH that I have in there was done in 2009. And the response rate was, it looks like it was out of, it was 41%, 332 out of 810 responded. 22% said that they had symptoms of PTSD. 18% said that they met diagnostic criteria for PTSD, and 86% met criteria for, it is called burnout syndrome. And again, this is back in 2009. So we're talking about 11 years later and so much more, right? We're not even talking about patient on nurse violence. I mean, that's a huge portion, obviously, but that's completely been taken out of a lot of the conversation. So that's why we were trying to refocus and stop with the virus stuff and start talking about, again, what we talk about is violence in healthcare, and about the mental health of nurses and all healthcare workers that work with us, including first responders. We have EMT in our group. We have CNAs. I love my CNAs. Woo! And we have respiratory therapists, we have police officers, we have military nurses, we have all kinds of people from around the world that are on our page, and this applies to them. So if we have we have a lot of people that when we do like a survey, a lot of people don't like to do surveys. Why do people don't like to do surveys? Because they don't see any changes happening. Right? So they get burned out. They get survey fatigue. We're talking about call bell fatigue. Now we're talking about survey fatigue, because nobody, they think that nothing's ever going to happen, that it's just a part of the job. We just need to, to get strong and deal with it and stuff like that. And what does that do? What happens when you tell a little boy not to cry? Have we ever thought about that?
Like, feel hopeless.
Exactly. And then where does that go? Learned helplessness. What you're doing is all of the things that you're trying to control somebody and put them in this little tiny box. This little tiny box. Everybody belongs in this little box. Yes, I sound like I have a little silly voice, because that's what this is. It's silly, right? Chrissy doesn't fit in this box. I sure as heck don't fit in this box. Mary does not fit in this box.
No.
Okay. So how in the world does everybody fit in the mold that everybody expects them to? They don't, because everybody's different, right? We knew that growing up. I'm just saying the obvious. So why are we all made to be being molded and conditioned to be something that we're advocates. stand up and say something that's not right. Those California nurses, I don't know if they had a union or not, but we should be standing up regardless of a union. And I am proud of those nurses regardless, because that whole unit said enough's enough. They got suspended, and I think that they had the suspension reversed. I'm not sure, somebody will probably say something, but they all stood up. They said something. Now, wouldn't that be something if everybody stood up and they said, no, enough's enough? I cannot wait. Like, I was talking to Erica, that's also in our group, and we were talking about having another rally, but do it like in March and April of next year. You know, let's see how we're going with this whole COVID thing. So that's going to be on our agenda. I'm excited about that.
It's really strengthened numbers too.
Yeah,
And we've seen it time and time again, like with the teachers, you know, in West Virginia and Kentucky and Oklahoma, you know, they went out and they got change. And I don't know why nurses have never banded together to do that. Like, I've always wondered that, because we're similar in what we do too. So
I have a good idea why. I have a good idea why, you know, I mean, even with just going on the doctors, I realized, wow, there's some really nasty nurses out there, right? If you're not a part of their group and you don't believe in what they believe in, they're going to give people a call if they get wind that you're going to be doing something special. You know, I mean, how is that? You know, I've reached out across all groups, and, you know, there's a couple groups that we don't really see eye to eye, but we agree because we agree. And then maybe they just don't see what I see yet, but they will, you know, and I see what they see, but there's a root cause problem.
Yeah.
Right. So, and they're valid with how they feel. I mean, they're absolutely valid, but there's more to it. You know, let's not stop that narrative. Let's keep it going. Right. So it's okay for people, you know, to speak their opinion and stuff like that of other people.
Absolutely.
That's fine. Nobody's going to sit there and hurt my feelings, but it's not about me. This is about us. It's not about me at all. So I want to take this moment to, again, I want to thank everybody for joining us tonight. And this is a special night. This is a special night. So this is Flo's birthday, and we're talking about mental health awareness. So do you guys have any closing thoughts, anything that you would like to add to our?
I know that this may sound a little cliche, and like people have said it time and time again, but I think that it's worth repeating. You know, we take care of our physical health. If we have high blood pressure or diabetes or something like that, you know, we make dietary changes, we take medications, we seek medical professional help for that. So why is our mental health any different? You know, we need to seek help, and it's scary. It's so scary. I can attest to that. But if you want to feel better, then, or at least get onto the path of feeling better, then that's gonna most likely be and you don't have to take medicine necessarily. It may just be that therapies are going to be helpful, and getting into groups and those kind of things that to talk about similar situations and hear how this person handled this versus the way that maybe I might handle it, and getting new ideas and new approaches to things, new coping behaviors, and trying not to avoid, but at the same time de-stress and those kind of things. So I think that it's really important that we remember that it is both mental and physical. It's still a human body.
So I got to ask you, Christy, what do you do to
woosah? So I have, because I have a lot of stress being in school and everything. So I went kayaking today. I live on the Gulf of Mexico, so I was able to go out. My husband and I, we went to the intercoastal and we went kayaking, and it was beautiful, and it was just so relaxing and serene. And I live in a community that has wonderful sidewalks, so I go on walks, help Peloton's free right now. The app is, so you can
What is it?
and do Peloton. You can download the app for free right now and do workouts to help de-stress, because a lot of people like to exercise to help de-stress. Prayer is important for me as well. Meditation, just relaxing in any form of water is wonderful. Baths, hot tubs, pools, whatever. So yeah, I try to relax. What do you do to relax?
Me.
Yeah, you have a lot of stress too. What do you do for yourself, Sandy?
Well, I'm in school full time. I work full time with students. I think laughing is the way that, and trying to just kind of like find humor, not negative humor, not like, I mean, yes, we all laugh at bad jokes or, dark humor, but it's to recognize that there's a limit, where it turns to be a little bit negative. But yeah, what I do, I love to laugh, and I'm moving back to the Gulf, where Nurses Against Violence started. And I think a lot of the advocating that I do and the talking and it really does help with, because before I wouldn't be able to really talk about my mom without crying, and of course I was getting a little choked up, but, talking about the things that have happened to you, that have that hang up, because most of your childhood experiences have happened and they've traumatized the way that you look at things as your future. So getting to the bottom of why I've been the way that I have been, and how, like, relationship wise, as well, with myself, has been very crucial to find out how I can not work with my past, to work with situations instead of putting that wall up. Stop putting the wall up. It's time to bring it down, right? So for me, it's trying to always be better every day, to try to help others. And I think I find a lot of happiness by doing that. And of course the laughing. And then I want to get back into kayaking and really starting to relax, because that was my end game, is to be in the Clearwater area. That was where I wanted to be. And I'm probably going to get back into roller skating with my kids. They don't know that yet, but I really miss doing that.
Something that you said reminded me, something that I've recently started doing that's really been helpful is I've been trying to be present. Mm-hmm. Instead of just, because I'm a future person. Like, I think about all my goals. I want to achieve my goals. I'm working toward them and everything. And I've always been this way, very goal driven. And so I realized that by doing that, I miss so much of what's going on around me. And so I'm trying to stop and just be present. And like today, we were kayaking, and we're in the intercoastal area, and there was just it was like a little tributary area where the wind wasn't blowing us at all. And I was able to just sit still and not row or anything, or paddle. And I'm just like looking around and just taking it all in. And it was just so peaceful, and just being in the moment. It was really great. So
yeah, I've done a lot of, like, over the past year, I've done a lot of, like, I've gone to like a warrior camp. I've done a lot of things to help bring some of this stuff out. And yeah, absolutely. Like, I'm always like, go, 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 do this, and it's like, like, not even a year and a half to finish my DNP. And then 2 weeks later, I'm into the Psych NP program, and then this, and then this, and then this, and then this. And it's like, Sandy, stop. Okay. You need to breathe. And it's like, I've taken the time out to breathe, but not long enough. My kids are already almost out the door, right? So I have to slow down. Not totally, but I need to slow down. I need to find my zen, but I think I'm more prepared now to be able to do that, and to be able to take others with me. I'm learning a lot you know, especially with being in the Psych NP program, and I feel like I bring a lot to it, as well as also to my students. And so they're going to be in for a lot. I know a couple of them might be on here tonight, but you just watch out. I'm coming after you. We're going to have fun. We're going to have scream therapy. We're going to have fun. So Mary, I want to hear about what you do. You live all the way out in Arizona, right?
Yes, and hiking is wonderful here. It's getting almost too warm, but that doesn't always stop me. I like to hike. I don't climb a lot of mountains. My knees don't let me do that, but I take my trusty camera. Here's my Nikon, and take all kinds of pictures of the wilderness that's here. Beautiful scenery, beautiful sunsets. That's my big thing to do. I haven't done it for a while, but it's time to get back out in the wilderness. I can't take my little dog for fear. We have rattlesnakes here, and I'm don't want him to get bit. But that's my love. I take my girls with me, but they're always schedules are all joggled up. So
yeah. So that's
awesome. Yeah. Other things I like to do, I sew, but I haven't done that for a while. Baking. Yeah. I just did that
I like to bake.
A couple of days ago. Bake cakes. Love to bake cakes and cookies. I'm not so much of a cook as I am a baker.
Yeah.
Ask my girls about my world famous let's see, salted caramel cheesecake.
Oh.
Not fattening at all.
No, it's all skinny, low. Yes, I make a and I know and that's and for those of you that are not nurses and you know coming on here, I apologize. We love food.
Yes.
Probably a little too much.
Love food, I think.
For me at least. But you know, and that's another thing with, you know, we got to take care of our bodies and stuff like that. But besides that, I make a great pistachio cake. It's like so yum.
Oh wow.
Saying. It's super simple. So if anyone wants that recipe, just let me know. I'll be happy to share. But I want to thank you guys for coming on with me tonight. And again, our audience, and let's see if we have any questions. Looks like Tim mentioned that there should be a special incident debriefings. Yes, I agree.
Yeah.
Agreed. Yeah.
And should have a special incident team. And, you know, and I think
that's a great idea.
Yeah, it is. Yeah. Absolutely. Well, I mean, that's a lot of things.
Like a whole team, not just like, because the trauma hospital that I worked at, the trauma ER that I worked at, you know, they would do debriefings after traumas and things like that. But, you know, I remember working at a hospital that didn't do trauma, and we ended up getting a trauma patient because she destabilized on her way to the trauma hospital. And so it was very traumatic. She grabbed my arm on her way in and said, "I'm gonna die." And this was 3 months after I passed the NCLEX. And I'm just standing there, my mouth was gaping. I'm thinking about all my nursing professors saying, when a patient tells you that they're gonna die, they're probably gonna die. And don't ever give somebody false reassurance. So I just looked at her and I said, "We're gonna do everything that we can to help you."
Mm-hmm.
And we did, but we just didn't have what we needed to be able to help her. We didn't have the tools. We didn't have the team of people that trauma hospitals have. And so she was 19. She died. She was in a car accident.
Aww.
She died. And after we coded her 3 different times, and we were doing rapid blood transfusion, and everything, but it just didn't work out. And the nurses that I was working with, they were all like mama bear nurses with me and everything. I got very lucky in that regard, being a new nurse coming into the ER. And they said, they told the chief nursing officer, you know, we need to have a debriefing because Christy's here and she's a brand new nurse. And, you know, this is like her first trauma as a nurse, you know, she needs to have a debriefing. And she goes, "Well, you know, it is what it is. It's fine."
That's the attitude.
So she ended up getting fired like a few months later for something unrelated. But it's that's a lot of what we face, in nursing is a lot of people saying it is what it is, and it's just
Nope.
and
Not.
I remember that was 14 years ago, and I remember that day like it was yesterday. I remember her face. I remember her first name. I remember everything. And I remember smells. I remember, and that's one of my traumas, and that will stay with me probably forever. So
Mhm.
it's there. And those are the things that we deal with. And so having like a team, like what Tim, was it Tim that
Yeah.
suggested that? I mean, that would be tremendously helpful, and having people to talk to, and you know, it,
Yeah. So, yeah, absolutely. There should be debriefings after any kind of traumatic episode, especially if you have newbies. It's very important that they see the support that they're supposed to have.
yeah,
There's a saying that says, "When nobody's looking, still do the right thing."
yep,
You know,
integrity.
yeah, it's that's just the way it is, right? So do you have anything that you would like to say in conclusion for today's podcast webinar? I can't figure out the name.
Ask if you need help, get help. If you need to talk to somebody, talk to somebody. If you want to private message me on Facebook, private message me on Facebook. Sandy, Mary, all of us are here for you. So please reach out to us. If we may not have all the answers, but we do have resources, and we can point you in the right direction.
Absolutely. Absolutely.
It's very important for anyone to know that it's very comforting to speak to someone who's non-judgmental.
Exactly.
And they need to know that. I think that's the stigma attached. Oh, they're going to judge me. I'm going to be criticized for thinking that way. In the relationship that I'm in, my husband's taught me to be a better listener because he suffered a lot of trauma as a child. And he points out to me, don't say it like that. And after I think about it, yeah, okay, then I didn't intend to say it that way. So he's taught me to be a better listener and respond better. Yes, I think it's important for people to know that there's no judgment, no criticism going on. You need to get anything off your chest.
Exactly.
What we want to hear.
And if things are triggering to you, don't worry about it. Don't understand that, it's going to be okay. You just need to talk to us or talk to somebody. That's what I mean, that it's going to be okay, because we can handle that. And like Christy said, we can help you find the resources that you can even give you suggestions on things that you can do for coping. Anybody that's in the our admin or even on our moderators. That's why we have them in place. Erica's awesome. We have Anna Marie. We have, and she's amazing. We have Candy. We have a lot of great people that can, we're all different kinds of people. We're not all the same. We have different views on different things, and we are human. You might not relate to me, and that's okay. There's other people that you may relate to. But just know that you're not alone. And I think that's where I want to leave this webinar, that you're not alone, and that you are equally respected, especially in our group. And I want to thank again everybody that joins together to help greet. And I think we have some new moderators that are just amazing. So you guys can reach out to them as well. And just take it in, and just know that this is your safe place, and we want to keep it this way. So if there's ever anything that's kind of off color, we might not have found it fast enough, so just report it to us and we'll be happy to take care of it.
Absolutely.
And it's important for everyone to feel safe. So I want to thank you, and we're going to conclude. And thank you again for taking the time out, and we won't see you next week, because I will be relocating, and we will see you the following week. So happy Nurses Week, happy Mental Health Month, and have a great evening. Bye.
Bye.
Bye.